Welcome to the channel. I am a doctor, and today I'll talk about 7 warning signs your heart is struggling, that most seniors mistake for fatigue. The transition into the later decades of life often brings a shift in how we perceive our physical limitations, and many individuals over the age of 60 fall into the trap of attributing every new ache or bout of exhaustion to the simple process of getting older. While it is true that the body's energy reserves are not what they were in youth, there is a dangerous tendency to use the word fatigue as a blanket explanation for symptoms that are actually urgent distress signals from the cardiovascular system. The heart is a remarkably resilient organ, but it does not fail in silence. Rather, it speaks through a series of subtle physiological shifts that are frequently dismissed as mere tiredness or a lack of stamina. For a senior, understanding the difference between the expected slowing of age and the pathological struggling of the heart is the most critical skill for maintaining independence and preventing a catastrophic cardiac event. In the landscape of 2026, where medical technology offers incredible interventions for heart health, the greatest barrier to survival remains the human delay caused by misinterpreting these 7 warning signs. The first warning sign that most seniors mistake for general fatigue is a persistent shortness of breath during routine activities that were previously effortless. This is not the gasping for air that follows a flight of stairs, but rather a subtle air hunger that makes you feel like you just cannot catch your breath while performing light tasks like folding laundry or walking to the mailbox. When the heart muscle begins to weaken or the valves become stiff, it cannot pump blood efficiently out to the rest of the body. This causes a backup of pressure in the veins that lead from the lungs to the heart, which in turn causes fluid to leak into the air sacs. This condition, known as pulmonary congestion, makes the lungs less efficient and requires the body to work much harder to oxygenate the blood. A senior might find themselves sitting down more often or claiming they are just out of shape when in reality their heart is struggling to keep pace with even the most basic physical demands. This breathless exhaustion is a primary indicator of early-stage congestive heart failure and should never be brushed off as a normal sign of aging. The second sign is a sudden and unexplained change in exercise tolerance, or what many describe as heavy legs. You may find that your usual evening stroll feels like a mountain climb, or that your legs feel weighted with lead after only a few minutes of movement. While many seniors attribute this to arthritis or a bad hip, it is often a sign of peripheral artery disease or a struggling heart that cannot send enough oxygenated blood to the large muscles of the lower body. When the muscles are starved of oxygen, they produce lactic acid and trigger a sensation of deep weariness and heaviness. If you find that you are consistently the last person in the walking group, or that you need to stop and rest your legs more frequently than you did just a few months ago, your heart may be signaling that its output is no longer sufficient to meet the metabolic needs of your extremities. Thirdly, many seniors experience a type of mental fatigue or brain fog that they mistakenly attribute to a senior moment or the early stages of cognitive decline. The brain is the most oxygen-hungry organ in the body, and it is entirely dependent on a steady high-pressure flow of blood from the heart. When the heart struggles to maintain consistent cardiac output, the brain is the first to feel the effects of the slight drop in perfusion. This can manifest as a momentary confusion, a difficulty in following the thread of a conversation, or a feeling of lightheadedness that makes you want to lie down and close your eyes. While we often fear dementia, the reality is that many cases of cognitive dullness in the elderly are actually vascular in nature. A heart that is struggling to pump effectively cannot clear the metabolic waste from the brain or provide the glucose necessary for sharp thinking. If your fatigue is accompanied by a sense of being mentally unplugged, it is time to look at the pump rather than just the processor. The fourth sign is a disturbance in sleep patterns, specifically the need to prop oneself up with extra pillows or waking up suddenly feeling like you are suffocating. This is often dismissed as a bad night of rest or acid reflux, but it is a classic sign of nocturnal heart struggle known as orthopnea. When a person with a struggling heart lies flat, the fluid that has accumulated in the legs during the day due to gravity shifts back toward the chest and lungs. This overwhelms the heart's ability to process the fluid, leading to a sudden and terrifying sensation of drowning. Most seniors simply adjust their pillows or move to a recliner, thinking they are just having trouble getting comfortable. However, the need to sleep in an upright position to breathe comfortably is a definitive sign that the heart is failing to manage the body's fluid volume and requires immediate medical evaluation. Fifthly, a subtle but significant sign is a sudden lack of appetite or a feeling of being full after only a few bites of food. This is frequently mistaken for the natural decrease in appetite that can come with age or a digestive issue. However, when the right side of the heart is struggling, it can cause blood to back up into the liver and the digestive tract. This venous congestion causes the stomach and intestines to swell, which leads to a sensation of bloating and early satiety. If you find yourself skipping meals not because you are busy, but because you feel heavy and uninterested in food, your heart may be struggling to move blood through the abdominal organs. This digestive fatigue is a hallmark of right-sided heart strain and is one of the most commonly missed symptoms in the geriatric population. The sixth sign is a persistent dry cough or wheezing that does not resolve with standard cold medications. Many seniors assume they have developed a late-life allergy or a lingering touch of bronchitis. In reality, this cardiac cough is caused by the same fluid backup that leads to shortness of breath. As fluid accumulates in the lung tissue, it irritates the airways and triggers a reflex cough that often produces a thin, frothy, or white-tinged sputum. If your fatigue is accompanied by a cough that gets worse when you lie down at night, your body is attempting to clear the fluid that your heart can no longer manage. This is not a respiratory issue, but a cardiovascular emergency in the making. The seventh and perhaps most elusive sign is an unusual increase in heart rate or sensation of the heart skipping a beat during periods of rest. Seniors often report feeling tired and then noticing that their heart is racing as if they had just run a marathon. This is often dismissed as anxiety or the effects of too much caffeine. However, a struggling heart will often try to compensate for its decreased pumping power by beating faster. This is known as tachycardia, and it is the heart's desperate attempt to maintain blood pressure despite its weakened state. If you feel palpitations or a fluttering in your chest while you are simply sitting in a chair reading a book, your heart is working overtime just to keep you upright. This internal exertion is incredibly draining and leads to a profound sense of exhaustion that no amount of sleep can fix. In the world of 2026, we must reject the notion that being tired is a mandatory part of being 70. We must become advocates for our own heart health by recognizing that these 7 signs are not markers of age, but calls for action. The heart does not have a voice, but it uses the body's energy levels and basic functions to communicate its status. When you ignore these symptoms, you are effectively silencing a warning system that was designed to save your life. Survival and longevity are built on the foundation of early detection and the willingness to challenge the assumption that you are just tired. Reclaiming your vitality starts with a shift in perspective. Instead of asking, "Why am I so tired?" ask, "Is my heart getting the oxygen it needs to power my life?" This proactive mindset allows for the implementation of lifestyle changes and medical treatments that can restore cardiac function and return the spring to your step. Whether it is managing blood pressure, improving hydration, or addressing a faulty valve, the options for heart repair are more advanced than ever before. But these tools are only useful if the patient presents themselves for care before the damage becomes irreversible. The cultural narrative surrounding aging often encourages seniors to be quiet and accept their decline. We must fight against this pressure. Your heart is the engine of your existence, and it deserves the same level of maintenance and attention as any other high-performance machine. By watching for these 7 signs and refusing to accept fatigue as a final answer, you are choosing a future of activity and engagement. Do not let your heart struggle in the shadow of a misunderstanding. Listen to the whispers of your body before they become a scream. To deepen this understanding, we must also look at the role of fluid retention and weight fluctuations. A senior who notices that their shoes are getting tighter or that their socks are leaving deep indentations in their ankles may assume they have just been standing too long. This edema is a direct result of the heart's inability to pull fluid back up from the extremities. If you find yourself gaining 3 or 4 pounds in a single week without a change in diet, it is not fat, it is water. This extra weight puts a massive strain on the heart, creating a cycle of exhaustion. The fatigue you feel is the physical weight of that fluid which your heart is struggling to move. Furthermore, the timing of your exhaustion can be a major clue. General fatigue often feels better after a good night of sleep. Cardiac fatigue, however, often feels worse in the morning because the heart has struggled all night to manage the fluid shifts of a reclining body. If you wake up feeling like you have been hit by a truck rather than refreshed by rest, it is a sign that your nocturnal hemodynamics are compromised. This morning exhaustion is a red flag that the heart is working against a hidden resistance while you sleep. The emotional impact of a struggling heart is also profound. Many seniors experience a sense of impending doom or heightened anxiety, which they mistake for the stress of getting older. This is actually a physiological response to low oxygen levels. The brain knows the body is in trouble and triggers the fight or flight response, leading to a state of chronic nervous exhaustion. By treating the heart, we often find that the anxiety resolves because the brain is finally getting the stable supply of blood it needs to feel safe. In 2026, we have the ability to track these metrics with incredible precision through home health devices, but the most powerful tool remains your own intuition and observation. You know your body better than any sensor ever could. If something feels off, do not let a well-meaning family member or a busy doctor tell you it is just your age. Insist on a thorough cardiac workup, including an echocardiogram and a stress test to see how your heart performs under pressure. This is the hallmark of health in the modern era. The refusal to accept a diminished life when the solutions are within reach. Ultimately, your heart is fighting for you every second of every day. It is your responsibility to fight for it by paying attention to the signs of its struggle. The exhaustion you feel is not a failure of your character or an inevitable part of your timeline. It is a request for help. By responding to that request with speed and clarity, you can ensure that your heart remains strong enough to carry you through many more years of joy and purpose. Reclaim your vitality by being the person who never misses the signs of a heart that is asking for a second chance. In conclusion, the 7 warning signs, breathlessness, leg heaviness, mental fog, nocturnal suffocation, appetite loss, persistent cough, and racing pulse, form a clear map of cardiovascular distress. When a senior masters this map, they move from a state of passive decline to one of active mastery. Your golden years should be characterized by the clarity of your mind and the strength of your movements, not by a constant battle with a fatigue you cannot explain. Give your heart the support it needs, and it will reward you with the energy to live your life to its fullest potential. The time for guessing is over. The time for action is now. The journey toward a healthy heart is a marathon, not a sprint, and it requires a consistent commitment to listening to the internal rhythms of the body. We live in an age of incredible medical progress, but the most advanced heart surgery in the world cannot fix a problem that is never identified. This is why awareness is the first and most important step in the ladder of longevity. By educating yourself and your peers about these 7 signs, you are building a community of health and resilience that can withstand the challenges of aging. Finally, let us reflect on the incredible capacity of the heart to recover when given the right conditions. The human body has an innate drive toward healing and balance. When we remove the burdens of poor diet, chronic stress, and unmanaged conditions, the heart can often regain much of its lost strength. This hope should be the fuel for your vigilance. You are not just looking for signs of trouble. You are looking for opportunities to heal. Every time you catch a symptom early, you are choosing life. Every time you advocate for a better treatment, you are choosing strength. Your heart is a miracle of biological engineering, and with the right care and attention, it can beat with power and purpose for a century or more. Trust in the wisdom of your body, act on the signs of struggle, and live your life with the robust heart you deserve. Protecting the heart also involves a deep understanding of the inflammatory processes that can damage the arteries over time. We must recognize that things like dental health and chronic low-level infections can put a constant strain on the heart, causing a type of systemic fatigue that is often overlooked. A senior who has persistent gum disease or recurring urinary tract infections is forcing their heart to work in an environment of inflammation, which accelerates the aging of the vascular walls. By treating the whole person and reducing these inflammatory triggers, we can significantly lighten the load on the cardiac muscle. We should also consider the role of medications and their side effects, which can sometimes mimic or mask heart struggle. For instance, some blood pressure medications can cause fatigue or leg swelling, leading a senior to believe their heart is fine when it is actually the medicine that needs adjustment. Conversely, a senior might be taking a stimulant for another condition that hides the natural fatigue of a failing heart. The only way to navigate this complexity is through a transparent and ongoing dialogue with a healthcare provider who understands the unique needs of the geriatric patient. As we move forward in 2026, let the narrative of aging be one of empowerment and precision. Let us stop using the word fatigue as an excuse and start using it as a starting point for investigation. Your body is a high-fidelity communication system, and the exhaustion you feel is one of its most important messages. By decoding that message and taking swift action, you are not just preventing a heart attack. You are ensuring that every day of your life is lived with the maximum possible vitality. Your heart has supported you through every joy and sorrow you have ever known, and now it is your turn to support it. Be the guardian of your own cardiac destiny and enjoy the long, clear, and energetic life that comes from a heart that is well understood and well cared for. The integration of regular cardiovascular screening into the routine of a senior is not a sign of fragility, but a hallmark of sophisticated self-management. In 2026, the paradigm of aging has evolved from a passive acceptance of limitations to a disciplined pursuit of physiological optimization. This means that a person over 60 should view their energy levels with the same precision that a pilot views a cockpit instrument panel. Any deviation from the norm is a data point that requires analysis rather than a reason for resignation. By refusing to let the 7 warning signs fade into the background noise of daily life, you are effectively extending your health span and ensuring that your later years are defined by what you can do rather than what you must avoid. Your heart has the capacity to sustain you with vigor and clarity well into your hundreds, provided you act as its dedicated partner and protector. Reclaim your future today by promising yourself that you will never again dismiss a struggle as mere fatigue. The strength of your spirit deserves a heart that can keep the pace, and with the right attention, that is exactly what you will have.